Hi everybody, it's Dr. Cole. A lot of patients go into their doctor because they're having some sort of symptom. They don't feel like themselves, they feel like just brain fog, fatigue, depression. They have some sort of symptom and they want to find out why they feel the way they feel. So they go to their PCP or they go to their endocrinologist. They run routine blood labs and your labs can come back as normal. So at that point you're at a dead end because all the labs are normal, right? And you're told basically go home and to just deal with it. But if you look beyond the superficial level of things, and the diagnostic testing that we do in functional medicine really does look at these underlying missing pieces of the puzzle. So one of the labs we run is the Saliva Lab through Diagnostics in Seattle, Washington. So I'm going to show you a sample lab from one of our patients. We covered up their name to protect their privacy. So here on this lab, we're looking at your brain function and we're looking at adrenal function. So what we see in the green here is where your cortisol levels should be at throughout the day, and then if you look where the blue is, that's where the patient's cortisol levels were actually at. So she's having really high cortisol throughout the day, and then if you look at the units of cortisol, she's way above the normal. 83 and 42 is the higher range of normal. So her body's really out of balance, and there's a huge amount of cortisol in her body and going into her cells. So if we look at the next page here, we're looking at DHEA, which is a hormone that we need to be healthy, to have normal immune function. She's really elevated. She's having complete immune dysregulation at this point. And then over here, the lab correlates your adaptation to stress. Most of our patients are in stages 5, 6, or 7, stage 7 being adrenal fatigue. Again, these issues are not being looked at and being tested for in the mainstream medical model, but we are finding out these underlying missing links that only this level of testing is going to find out and uncover. And then over here we have food intolerance panel. She was negative, but we're running antibodies for all these different common allergens such as milk, soy, egg, and gluten. And we have other even more detailed and more extensive labs dealing with food intolerance if the case needs it. Then over here we're looking at female hormones, we're looking at the different estrogens, and then we're looking at progesterone and then free testosterone levels. We're looking and with this level of testing with saliva, you want to look at not only blood and just say that's the end-all be-all, because blood labs normally looking at protein-bound hormones. So it's not looking at the free fraction or what is actually metabolically active, what's actually getting inside the cell, which only the saliva, unless it's marked free on blood, only saliva will tell you. So this is telling you what hormones actually your body's using. What is the free fraction hormone levels? So saliva is another piece of the puzzle that you need, that if you're having unanswered questions, you're going to want to have a lab like this done. And all the labs done in our clinic is done at our cost. So there's a patient cost that's normally a lot higher, but we always check on the requisition forms, bill clinicians, so patients can get these answers, get these solutions to their health at our cost, because we want to get them better and we want to really customize and tailor a treatment plan once we know what is going on with them. Alright guys, take care.